Hi, this is Dr. Nick. I'm the Incrementalist here with incremental steps for a healthier life and business.
And I'm Fred Goldstein with Accountable Health, working on healthcare system redesign for the 21st century. So let's start this week, Nick. What's the latest going on with COVID from a medical perspective?
Well, there's, as usual, fast-moving developments. I think, again, the positives that I always take out of this is that tremendous sharing amongst clinical professionals from a research standpoint, continuous sort of updating. From a general population and a business perspective, that's very confusing because what used to be the case last week would be different this week. For example, the masks, which we talked about last week, changed, and now there's a sort of general indication. And in fact, in my state, they've now issued an edict that you can't go out and can't be shopping without having some sort of covering. They're prefacing that with, use just regular, just a bandana or something as a minimum so that we don't overuse the materials for the healthcare team. From a change perspective, it's interesting to watch the Sweden experiment. A lot of people are talking about that. They're essentially saying, we're not going to do anything, we're just going to let this disease run its course. And when you compare their numbers to a sort of comparable state in the United States, New Jersey's about equivalent, about 10 million or so population. New Jersey's seeing about 2,200 deaths. Sweden is seeing about 900. So that's a discrepancy, and you go, wow, Sweden's got the right answer. That's not the case. We have to be cautious about how we interpret that because there are so many other things, and I think you're going to talk about that in a second. The other thing I would say is that there's new treatment sort of thinking about this. We're seeing a difference in some people's approach to ventilation. Not everybody is suited for ventilation, even though they need to be admitted, they're very sick. We're finding that a lot of people are dying post-ventilation because maybe they're not best suited. So we're learning on the go. This is very challenging, and everybody is doing the best that they can with the information that they have. The one thing I would say to employers at this point from a medical standpoint is, even if you have somebody that has COVID-19 and recovers from it, that recovery is not, wow, they're great. This has a pretty long tail of impact from just general energy and capacity. So being conscious of that is extraordinarily important, and allowing people the time to recover and the opportunity to sort of really slide back into work, which is not going to be easy.
And let me ask you that, Nick. As they come back to work, one of the questions is, I'm seeing some people say, hey, you should be taking temperatures when they come back and things like that, or even for your initial employees coming in on a daily basis. Is that something that's recommended?
Well, so there's clearly some value to that, because obviously if you have a temperature, you're running a fever, and we know that that's associated. So I think that's a reasonable policy, but that doesn't stop you from having to do the other things. So the physical distancing remains important if you've got people coming in, and obviously the face mask to prevent transmission and so forth. And that's because people don't develop the fever until 2 to 3 days later, and they can be infected during that period of time. And there are people that appear to be asymptomatic. We're even talking about super spreaders. What a terrible idea. But people that have the disease have no symptoms, but end up spreading it to lots of folks.
Mm-hmm. And one of the other ideas that's been coming up now is, obviously our healthcare workers are doing an amazing job. They're in really difficult situations. I've watched some unbelievable videos of nurses and doctors talking about their experiences during the day. There's this new talk, hazard pay.
Yeah, I have to say I'm a big fan of that. We have that for the military. We applaud our military and the service that they give in the protection of our freedom and rights. And we're applauding our healthcare workers in the same way. What a wonderful idea that we might deliver them some additional pay for extreme exposure. Bearing in mind that extended exposure is a cause for increased chances, and not only chance of getting the disease, but actually suffering severe impact of that disease. And that's happening to our clinical colleagues. So I think great idea. So Fred, what about you in terms of, the development? I know exciting time, your son's been going through quarantine period. Where are you with that?
Yeah, thanks so much for asking. So my son, drove down from New York, out of Brooklyn. Glad we got him out of there. And when he came in, obviously, the governor had started this whole process that if somebody comes in from out of state, in particular New York, New Jersey, Washington, I believe it was, they met at the state line and they are told that they have to quarantine for 14 days. And so what we did is set up a back bedroom that has an outside door, and he came in that door and locked himself in. He has not been in the rest of the house since. He's been in the backyard a few times, and that's it. And so we've reached the final of that. He has no symptoms. So far, so good. So I think today he gets to come out for the first time and actually come into the rest of the house, which means he'll get back to his bedroom. I can go back into our bedroom and life goes on, which will be much better. Yeah, great
Yay,
stuff.
that's fantastic. So what did you learn from that?
So it was really interesting to watch all of the different things we had to do. I quickly put a refrigerator in there and a microwave and had food in there. And then we deliver stuff at the back door and walk away. And, there were certain supplies he needed at certain times, but it was really a tough experience because you're 5 to 10 feet away from him and you're, either talking through the door or you're on Zoom or you're in chatting or FaceTime.
Wow.
And so it was definitely very different. We did have one fun night where on a Saturday night, we got together with my other son and had a fun discussion and checked out different websites and things. But otherwise, it's been a little bit weird, and I'm really glad he's going to be coming out.
Well, that's great. I'm glad.
Yeah.
Tell us a little bit about the sort of impact of the disease and how you're seeing that from a sort of penetration of the population.
Yeah, this really sort of fits into the work I've always done over the years in Medicaid or with disadvantaged populations. And it's really kind of sad. We're seeing how impactful this disease is on people of lower socioeconomic groups who tend to have more comorbidities. And as you said, when you're comparing New Jersey with, say, Sweden, there's some issues with Americans in terms of our culture, how we live, how we eat, and that's impacting us. We're seeing, obviously higher rates of African Americans who are dying from this disease or getting the illness. And it really goes back to these social determinants of health. And one of the things I think we're going to see come out of this over the next few years is a better understanding and focus on those issues. And I hope it does, to begin to help mitigate that so that individuals in lower socioeconomic groups don't have issues associated with their life because of the position that they're put in. We can fix some of these things. We can get healthier foods in. We talked about earlier before this, the rates of death with those who have obesity is much higher. Obviously, obesity leads to heart disease, diabetes, other issues, kidneys, et cetera. And you start seeing that impact now. And I think we're really beginning to see it resonate with the public and politicians. The physicians have known it for a long time, as you have and have talked about numerous times. And so I'm hoping we finally begin to see some new innovative approaches in that area and create a 21st century healthcare system that meets the needs of all of our population and not just those who happen to have means.
It raises an interesting thought, really. If you think about it, instead of spending all this money on sick care, if we'd spent all this money and actually had a fit, healthy population that were getting good food sources, had good housing, all of those things, we would actually have a much lower impact of the disease because we wouldn't have these underlying conditions. So from a driving force, it seems like this would be a fantastic one to actually change the way that we deliver care and deliver society.
Absolutely. The question then becomes, how do you do it? And there's always this thing, we need to fund it. How do we fund those services? Well, I personally believe that the funds are within our healthcare system. We know the latest report, 25% of healthcare is waste, fraud, and abuse. That's $800 billion or something like that we could move to these others. But remember, as we always deal with it, somebody's waste, fraud, and abuse is somebody else's income. And we've got to figure out how to shift the system away from this acute care system. We've talked about it for decades. How do we finally do it? And I think that'll be the interesting thing to watch over the next couple of years.
Yeah, I think that's a great point, is that, re-articulating the way that we spend this money in a different way and actually removing, and you're right, there are going to be people that are upset about that, but I think they have to reorientate in the same way that every business is reorientating. We're not doing things that we used to do before. We've got these conferences off the table for now. I'm sure some of it's going to come back, but it's going to be very different. That's got to be true for healthcare as well.
Absolutely. I think we're going to see change, as you mentioned, Nick. And with that, it's been a pleasure having you all on. I'm Fred Goldstein with Accountable Health.
And I'm Dr. Nick with Incremental Healthcare for better insights for health and business.